The purposes and benefits of a graduated medical compression stocking is to control lower extremity edema and not to reduce edema. It is often used after a course of treatment using compression dressings to reduce edema. It is to be worn whenever a person's feet are below their heart. The compression stocking is made of short stretch elastic, which is very different than long stretch elastic, commonly referred to as an ace bandage, and is available in various sizes and lengths. It is the short stretch material that prevents the wearer from developing edema when wearing the stockings. However, the short stretch material is also the reason that the stockings are so difficult to don and doff. The term graduated refers to the fact that although they have the same amount of compression throughout the stocking, the smaller width of the stocking at the ankle compared to the calf results in a net increase in compression distally, thereby facilitating venous return from a distal to proximal direction. The exception is that the material in the toe box is much less compressive than the rest of the stocking to avoid pressure injury to the toes.
Before applying a compression stocking, visually inspect the patient's skin. When donning the stocking, turn it inside out. Reach for the heel. Pinch and hold the heel while pulling the rest of the stocking inside out. Please notice the change in stitching at the toe cap. This will be very important in a moment. With the stocking inside out, slide it over the toes and push it toward the heel until the toe material is in contact with the toes. Remove your fingers and gather only a few inches of the calf portion of the stocking and slide it over the heel and halfway up the calf. Remove your fingers, slide your thumbs in the portion of the stocking that is doubled over the foot and slip it up and over the heel, ensuring the heel of the sock is over the patient's heel. Return to the calf and pull the sock up toward the knee, removing any wrinkles that may be present. Again, return to the toes and pull material away from the toes slightly. Inspect the compression stocking, making sure it is applied correctly. If a person has sensation, they should feel a firm yet comfortable amount of compression, especially when they pump their ankles or ambulate. That mild amount of pressure will assist the venous system in returning flow toward the heart. When removing a compression stocking, pull it from the top and continue without stopping, if possible. Do not stop and try to gather it under your fingers, as the short stretch nature of the material will make this very difficult for you and uncomfortable for the wearer. Compression stockings should be rinsed out or laundered after each day's use. Do not place them in a dryer, but rather hang them to dry.